Borderline personality disorder is a mental health condition that messes with how you see yourself, making it hard to handle your feelings and keep relationships steady. People with borderline personality disorder have a higher chance of feeling really down and hurting themselves. It's not super common, affecting about 1 to 2% of adults. On this episode of A Healthy Dose, we're going to dive deep into borderline personality disorder. If you see the world in simple terms of good or bad and feel really down and scared of being alone, you could be going through something called borderline personality disorder. It's like living in a black and white world with no in-between feelings. Borderline personality disorder is a mental health condition that messes with how a person sees themselves, handles emotions, and builds relationships. It's not super common, affecting about 1 to 2% of adults. Think of it like a spectrum. It shows up differently in different people. Some might struggle with anger outbursts, while others might face more serious challenges like hurting themselves. The reasons behind borderline personality disorder aren't completely clear, and it often coexists with addiction, other mental health problems, and eating disorders. Factors like a neglected or abusive childhood can contribute, as well as genetic influences, because there is currently no biological test for diagnosing mental disorders. We rely on identifying symptoms to better understand this. Let's look at Jonathan's situation. Jonathan, a 21-year-old college student, has always been a sensitive person. Lately, he has been feeling even more emotional and isolated. He is going through 5 symptoms commonly linked with a certain condition. Now let's look into the symptoms of borderline personality disorder. Symptom number 1, distorted self-image. Jonathan undergoes swift shifts in how he sees himself. Within a day, he can swing between feeling extremely confident and valuable to suddenly feeling utterly worthless. When faced with a crisis, he switches from one personality to another. During these times, he goes through moments of dissociation, where he feels disconnected from his own body and has no clear sense of who he is. This is often referred to as having a distorted self-image. Symptom number 2, intense and unstable emotions. Jonathan goes through strong and unpredictable emotions. Even small problems can make his mind feel chaotic, leading him to quickly end friendships. Every emotion he has is really strong. Happiness feels like extreme joy, and sadness can turn into deep depression. This emotional ride tires him out, and that's when he disconnects from his feelings. Symptom number 3, impulsiveness. He has a hard time controlling his impulses. When he talks to his friends, Alex often feels like they don't really get him. Because he has very little self-control, he sometimes ends up yelling or getting angry. Afterwards, he feels embarrassed about it. To deal with these feelings, he either eats a lot, uses drugs, or becomes violent, usually towards himself. Symptom number 4, fear of abandonment. He is really scared of being left alone. For instance, when his friend cancels plans suddenly, he ends the relationship. But then, just a few minutes later, he sends him a bunch of messages begging for forgiveness. He's always anxious that his friend might leave him and expects him to constantly reassure him at an unrealistically high level. Symptom number 5, unstable relationships. All of these issues contribute to unstable relationships. When Jonathan worries that he might be left alone, he ends up hurting his friends without any clear reason. He believes that by distancing himself from others, he can prevent them from pushing him away. Later on, he feels guilty and vows to make positive changes. During a challenging phase of intense paranoia, Jonathan contemplates quitting college, which is currently the only stable aspect in his life. It's at this point that his best friend encourages him to seek professional help. Let's now talk about the treatment. When Jonathan talks to a specialist, he discovers that borderline personality disorder is usually treated with types of talk therapy such as cognitive behavioral therapy, dialectical behavioral therapy, or mentalization-based therapy. The doctor also mentions that in some situations, people with borderline personality disorder may take medications like mood stabilizers. This is significant because more than half of teenagers who try to harm themselves are found to have borderline personality disorder. Knowing about his condition brings relief to Jonathan. At least now he understands that he is not alone. So, what are your thoughts? How do you think that we can support individuals with borderline personality disorder? Please feel free to share your insights or personal experiences with this condition in the comments below. Thank you for watching. Please like, comment, and subscribe. Watch more videos by clicking on the video here.